Good afternoon, everyone. It's my pleasure to welcome you all to this insightful webinar on oral hygiene and general problems organized by Vayah Vikas in collaboration with Clove Dental. Oral health plays a vital role in our overall well being, yet it is often neglected. Today, we have the opportunity to gain valuable knowledge on maintaining good oral hygiene and addressing common dental concerns from an expert in the field. We are honored to have Dr. Sandipan Bhattacharyya with us. He is a highly skilled dental professional with over 16 years of clinical experience, including 14 years of service in the Indian Army. He completed his BDS from the Army College of Dental Sciences and is currently pursuing an advanced management program in healthcare from ISB. Dr. Sandipan is a fellow to the International College of Continuing Dental Education and is well versed in a wide range of dental procedures. His commitment to delivering comprehensive dental care has made him a trusted expert in the field. We are excited to have him share his expertise with us today, and I'm sure this session will be both informative and engaging. With further ado, let us welcome Dr. Sandipan Bhattacharya. Over to you, Doctor.
Thank you, Ms. Aswini. And first of all, good evening to all my seniors. Thank you for giving me this opportunity to address you all on a issue which is often neglected, but is very important in the whole scheme of things. That is our oral health. So I hope my screen is visible to everyone.
Yes.
Sir, yes, sir.
Yeah, so as already mentioned by Ms. Ashwini, I have served in Army for 14 years and have been associated with Clove for the last 3 years then. So the first question which we generally ask ourselves is why should we at all bother about our oral health? Because so generally we have all of us have two eyes, two hands, two legs, but teeth, as far as teeth go, we have 32 of them. Some of us have less, but generally we have multiple teeth. So even if we lose one or two, what difference does it make? So just a second, I lost the screen again. Yeah. So even if we lose a couple of them, what difference does it make? So the thing is that because although individually there are 32 or in some of us little less number of teeth are there, but they work as a unit, they work as a combined unit. So even if we lose only one or two of them also, the overall integrity of that system will be altered. And that is why it is important even if we are missing one or two teeth. So it is not like that, okay, I have 32 teeth. If I have lost one, so it will not make much of a difference. I'll demonstrate it later on during the course of this session through a video how it affects the other teeth as well, which are in place. If you lose a single tooth, also it affects the entire the ecosystem of the oral cavity. Second question, which we often tell ourselves for not visiting a dentist, is that I am okay in the way I look, or I am okay with the way my teeth are arranged. So, the primary function of teeth, of course, nowadays cosmetic part has also is also it also plays a big role. But originally, teeth were given to chew things, to chew our food stuff, and if the arrangement of teeth is not proper, then over a period of time the forces will be acting on these teeth in such a way that we slowly we'll start losing one by one all our teeth. So that is why arrangement of the teeth is also important, and that is why nowadays we try to encourage people, young individuals, to get their orthodontic treatment done so that in future they do not have to face any problem. Third question is, my teeth are not decayed. The thing is that, as I told you, that they work as a single system. All these 32 teeth or 28 teeth, they work as a single system. So inside your mouth, between the two teeth, what is happening? You naked eye is not trained to catch those things. That can only be seen through sophisticated equipments, through x-rays and other stuff which is present there only with the dentist in a dental clinic, in a dental setup. It cannot be seen or diagnosed in a home environment or through naked eye. So even if you are not feeling pain, because in dental, because the tissues are hard, that is why pain comes at a very very later stage. And more often than not, that at that stage there's not much which we can do to save the tooth. So pain is not a, the next question then, I do not have pain. So pain is not an indicator, not having pain is not an indicator that you have healthy oral cavity or healthy teeth. Because as I already told you that pain comes at a very, very later stage because these are hard tissues. So generally the topmost layer, it is devoid of any nervous tissues. That is why wherever there is a nervous tissue, you will have pain. But because the outermost layer is not having any nervous tissue, that is why when initially these caries, what we call caries means the cavities, these start, there is no pain at all. So generally the pain starts at a very very late stage. The gap is lucky. This is also many people say. So people, your the youngsters in your family, they'll say that okay, this gap is there, so it is lucky for me. It's just a way of not getting the treatment done. It's so basically a gap has nothing to do with luck. I don't feel that I have bad breath. So bad breath is something which the individual you are talking to or you are close to an individual, those people will realize that you have a bad breath. You yourself never realize that you have bad breath. People generally tell you, or most of the time they hesitate telling you because it is not considered to be polite. So generally you come to know from other people, the close ones, that you have bad breath. So you yourself will never feel that you have bad breath. I will wear dentures when I am old. So if there is a possibility of not wearing dentures or delay wearing dentures, then why not use that option? If we can save the teeth and delay, probably after a certain age, yes, dentures are the only option. But there are a few alternatives which we'll discuss again in due course of time. If we can delay or postpone wearing dentures, then why not? And does the oral health affect my overall health? Yes, it does. Because oral cavity is termed as the gateway to the body. So everything, whatever you eat, you are breathing, the good bacteria, bad bacteria, everything enters through your oral cavity. So your oral health definitely affects the overall health. So what is a healthy mouth? We are talking about oral health now. So how can you guess then if these things are not there, and then how can you say that one has a healthy mouth or a healthy oral cavity? First, of course, is a no-brainer that absence of any tooth decay, we call it dental caries. Absence of any swollen gums, absence of any malodor or any kind of bad smell, well arranged teeth, which is not only for looks, I've already mentioned. Presence of all teeth, that is also a sign of good health. Because even a single missing tooth can lead to very many different sequelae of diseases. No jaw pain or joint sounds, ability to eat all kind of food items. If you have a healthy food, if you have a healthy oral cavity, great gums, good teeth, then you should be able to eat all kind of food items even if they are hard. And finally, a confidence to have a great smile. So as we already discussed that the oral cavity is the gateway to the body. So definitely whatever. So this is one scenario which is given, how oral cavity is related to diabetes. So what happens if somebody has already has diabetes? So there will be reduced salivary flow. The saliva flow to the in diabetes is reduced. So this will lead to dry mouth, which will again lead to gum problems, which will lead to tooth decay, decaying teeth, and again because of decay, you will end up losing more teeth, and you will not be able to eat the proper diet which is prescribed for diabetic people, and again the uncontrolled diabetes increases. So this is a kind of a vicious circle. If one thing leads to another, which leads to another, and it is like a circle. It keeps on increasing. Also, in uncontrolled diabetes, the blood vessels are thickened, which leads to a situation called gingivitis, wherein even a small touch to the gums leads to bleeding. Then the WBCs are also affected, which leads to poor healing. If there's a cut, small cut in the oral cavity, or after extractions, the healing is hampered, and it is more prone to bacterial and fungal infections. So as you can see, oral health is related to all these kind of diseases: Alzheimer's, pneumonia, kidney health, premature deliveries, pregnancy, heart health, unexplained headaches, and mental health. Everything is related to oral health. So by just taking care of the oral cavity, these 32 or 28 or whatever set of teeth one has remaining, but just by taking care of that, you can avoid, potentially avoid having some serious systemic issues. So how do you ensure good health? What are the good practices? That is what this talk is all about. First thing is brush twice a day, because no one gets it first, no one gets it right the first time. So why we say you have to brush twice a day is once in the morning and once at night, because during the day, whatever you are eating, whatever you are taking in through your oral cavity, at the end of the day, before sleeping, before going to bed, you have to clean the oral cavity. And then after that, you are not supposed to have anything. You just have to go to bed. Then again in the morning, you get up, you brush. So brushing twice a day, once in the morning and once at night before sleep. Second is use of interdental brushes. So what happens is, after it is a normal process in aging that your gums start going down. Initially, when people are young, the gums are tightly bound to the teeth, but slowly the gums become loose and they start going down. That is when you have gaps between your teeth, and if you have gaps, you will obviously have food lodgement in these gaps, and that will lead to further infection, dental caries, and other things. So using interdental brushes, these are specialized brushes which go between the teeth. So normally the brush which we use, that has got a bigger head. These interdental brushes have got very small pointy heads, wherein you can easily insert it between two teeth. They come in various sizes also. You can search on Google and find interdental brushes. You generally Colgate, Oral B, Stims. These are the companies of which you will get the interdental brushes. They are very useful in when you have gaps between teeth. Other than that, nowadays the latest technology which is being used is are water flossers. So these are also for interdental cleaning between the teeth. These are specially useful if people have implants already. Some of them, if some of you have implants already placed in your oral cavity, and a crown on top of that, so water flossers really help in cleaning between these implants and the natural teeth. But in general also, water flossers are very effective. Then use of mouthwash, but when prescribed, not unnecessarily going to a supermarket and buying a mouthwash to have it, because mouthwashes are generally medicinal, and if your dentist feels that yes, you do require a mouthwash, only then use it. Otherwise, don't use it. Otherwise, just brushing twice a day would be enough. And if you have gaps, then use interdental brushes also along with brushing. Interdental brushes are not a replacement of brushing. That the twice brushing is definitely required, but this is an additional procedure that interdentally you should be able to clean with these brushes. So brushing is non-negotiable, that twice a day everybody has to do, but these are some adjuvants to help you maintain your oral health better. So interdental brushes, water flossers, mouthwash if only prescribed by the dentist, otherwise no. Eating fibrous fruits and salads are also great for general health also, and also because they are fibrous, there will be a lot of chewing involved, and chewing stimulates the salivary glands, and there will be more saliva flow, flushing of bacteria. Good bacteria will, there will be a turning of good bacteria inside the oral cavity. So eating fibrous food is also very good for oral health. Then avoiding sugary snacks and meals, which we generally avoid. Tell our children that please don't eat that, or the grandchildren, don't eat this, don't eat sugary stuff, don't eat sticky sugary stuff, and always rinse if you are eating anything like that. Same thing applies to us as well. Abstain from having sticky food items, because what happens is, more than sugar have to be in contact. The sugary food stuff has to be in contact with the surface of the tooth. Only then there will be cavity. Otherwise, if you generally wash it off, it will not lead to cavity. So sticky food items are generally difficult to wash off, especially from the nooks and crannies of the teeth. There'll always be some amount of sticky food item left behind, and that will lead to dental decay later on. And finally, visit your dentist once in 6 months or at least once a year, because as I told you, to naked eye it might feel everything is fine, but in a dental setup with specialized equipments, with x-rays and other stuff, intraoral cameras, it is, we can diagnose even the smallest of the cavities. So here are some myth versus fact. Normally what we generally hear, that this will happen if this, we do this. So we are here to shatter some of the myths. First one is, teeth cleaning loosens the teeth. How many of you have experienced it? Can anybody please say? If you've got teeth cleaning, as in the one which you get done at the dentist's office, dental office or a dental clinic. After that, how many of you have felt that your teeth have become loose?
have.
Have you felt that, sir?
Yeah, I have.
You have. So what happens is, basically, as I told you, with advancing age, the gums become loose and they migrate apically, as in they go down, and your roots are visible. So in general, your, suppose this is the tooth, this is the crown portion of the tooth, and this is the root portion. So it is covered by gums, which is called gingiva. And with advancing age, the gingiva slowly becomes loose and starts going down, right? So this is what happens. So the root becomes exposed, and that is why there is gap between two teeth. So what happens when the roots are exposed and there's a gap? Food stuff get accumulated between the teeth, within those gaps, and over a period of time they become hard. So there's something known as plaque, which generally accumulates within 5 to 6 hours of brushing. And if proper brushing, so in all areas, if a brush is not reaching and cleaning properly, then in those areas that plaque still remains in those gaps. And over a period of time, they calcify. Calcify as in they become hard. And then you cannot differentiate between a hard calcified plaque and the tooth. It feels a part of the tooth only, whereas it is not tooth, it is plaque, calcified plaque, which we call tartar. So that plaque feels like, if you feel with your tongue, it will feel like a part of your tooth only. So but it is important to remove that, because inside that there is a lot of bacteria which is accumulated, and it leads to further damage to the tooth as well as the gums. So when we remove that with our specialized instruments, there is a gap created. So that gap was already there. It is not created during the process. But if you don't get this done, the cleaning done, then the gaps will increase slowly, slowly. Only thing is that those gaps will be filled with calcified plaque or tartar. And later on, the tooth will become loose and it will fall off. So cleaning does not lead to loosening of teeth. Basically, the gaps and the the tooth was already loose to start with. Only thing, because of this tartar and the calcified plaque between the teeth, probably they were still slightly firm. However, that was just an illusion, because once they are removed, you will feel how mobile the teeth are. And had, if you don't remove it, it will become even more mobile, finally leading to the loss of the tooth. You will lose the tooth. So cleaning of teeth is very important. It does not loosen the teeth, because basically the instrument which we use, it very lightly touches the tooth. The cleaning actually happens with a jet, ultrasonic water flash, water stream. With that, the cleaning happens. The instrument is very lightly in touch with the tooth, so the tooth cannot become loose, or neither can gaps develop by cleaning. So please go to your dentist, have your teeth cleaned at least once or twice a year. Second myth: the harder you brush, the cleaner your teeth become. Another myth, because the harder you brush anything, if you rub against a surface for day in, day out, twice a day, for so many years, it will abrade that surface. The surface, slowly, it will abrade the surface. That's what happens when you brush very hard. You need not brush hard, you have to brush in the right way. You have to know the technique how to brush correctly, which I'll demonstrate further down the with a video. I'll demonstrate it. So basically, it is not how hard you brush, it is how well, and if you are brushing properly twice daily or not. That will determine how clean your teeth are. Because too hard brushing is harmful for your teeth. Also comes. Another myth: uh, um, diet soda won't harm my teeth as they don't have sugar. I don't know how relevant it is in this forum, but for your kids or your grandkids or anyone, any younger people in your family, if they are having diet soda and saying that okay, it does not have sugar, yes, it does not have sugar, but soda is still acidic, and any drink that is acidic or basic will damage the teeth. Another myth is that if nothing is bothering you, you really don't need to visit the dentist. This we have already discussed, because these are hard tissues. The pain comes at a very later stage. So it is always smart and advisable to at least get your teeth checked once in a year, or at least once in 2 years, by a dentist, to see that everything is in order. Children's milk teeth, another myth, are not permanent and they do not need any treatment. Again, this is a myth, because yes, they do fall off in children. First, the milk teeth come and then they fall off, and the permanent teeth are follow them. But what happens is that even when the milk teeth are present, beneath the milk teeth, the permanent teeth are forming. It are Those teeth are in their formative stages. So if the milk teeth has caries infection, that infection might get transmitted to the forming permanent teeth as well. And because they are forming at that time and there's an infection, they will not form in a proper way. A front tooth might not form in that particular shape which it is supposed to take because of the infection. So, and that permanent deformity will always remain there. Then you'll have to get a cap fitted or a crown fitted over that tooth to make it of normal shape. So it is very important to treat children's milk teeth as well, because there is a chance that the permanent teeth which are forming underneath, they also might get affected if infection is there in the milk teeth. So milk teeth in children act as space maintainers. Space maintainers is nothing because it is just they are occupying that space which later on the permanent teeth will take up, and it guides their permanent successor in the proper position. Right. So if regular checkups are not done, there will be development and underlying issues which will remain undiagnosed. So this is also a myth. Even if it is a milk teeth, of children, it should be treated. Another myth is that poor oral health will only affect my mouth and teeth. Discussed it multiple times during this talk, that this is the gateway to the entire body. So obviously, if something goes wrong in the oral cavity, there will be effect to the other systems as well. Okay, so as I told you, I'll be telling you the correct way of working, And so what best ways to show you a demonstration, which I cannot show because it won't be visible properly. So what I'll do, I'll play a small video. Is it playing as well now?
No, it's not paying. It's just starting.
It's still not playing?
No, no, it's playing.
It's playing, right? Okay.
Yes, please.
Play.
So these are the wrong techniques, the first two. This is not this is not how you brush. Now the correct technique starts. From the gums down to the tooth. And for the upper and lower jaw separately. From the gums down. For the upper teeth. For the lower teeth, it is up from the gums. Same for the inner surface as well. From the gums down for the upper teeth. For the chewing surfaces, this is how it is supposed to be, the brushing. Because food gets stuck over on the chewing surfaces, that is, there are a lot of small crevices there. So this is how you brush. And now for the lower jaw. For the lower teeth, you move up from the gums. Like you are doing the other way for the upper teeth. Here you move up from the gums in the lower teeth. And inside also to be cleaned. Again the chewing surfaces. So typically a brushing full brushing stint, so to speak, should take around 2 minutes, because this is how you do it. Otherwise 30 seconds will also be sufficient. But if you have to do it properly, then it has to be done at least for 2 minutes. Yeah, so that was about brushing. So were you aware of this technique? This is a very simple technique, nothing very complicated. The basic idea is, for the upper teeth, you have to brush from the gums down to your tooth, and for the lower teeth from the gums upwards. Similarly, this side also and inside also. For the front teeth, what in the video was slightly faulty was because you cannot put your brush head this way. It will be difficult. It has to be turned vertical for your front teeth inside. Similarly, front teeth, lower teeth inside, you have to hold it vertically and do it like this, from the gums upwards. For upper teeth, from the gums downwards. Otherwise everything shown in the video was correct. Only modification is, for your front teeth you have to hold it vertically, otherwise you won't be able to place it. It won't be in contact with the tissues and the teeth properly. There will be a gap if you place it like this inside. From outside it is fine, but inside it is difficult because of the curvature of your jaws. So okay, I'll share the presentation again. We are done with brushing. Okay. Now talking about dentists, let us see what we all can offer you, what all services we can offer you. So the first is scaling, like removing of plaque and tartar. You can see these two photographs. This was before the procedure and this is after the procedure. So the first is scaling, very basic procedure. Uh, it is pain free, although there might be a little bit of sensitivity, as I told you, because the roots tend to get exposed which are covered, which is generally covered with plaque and tartar. So once that is removed, there is a bit of sensitivity. Otherwise, it is a very painless procedure. So that is one very basic procedure. These are fillings. Composite fillings are tooth colored fillings. So as you can see in this photograph, the photograph above and then the one below, you cannot make out the difference. It feels as if it is a part of the tooth only because of its color and texture. Again here, you can see the cavities were there, and in the photograph below, you can hardly make out. Similarly, these two photographs. So these are tooth colored fillings which are durable, very strong, and nobody can make out also whether a filling is there or it is a part of a tooth. Root canal treatments, you all must have heard of it. So what happens is that inside the tooth there is a bundle of nerves and blood vessels. Once that gets infected, once the cavity reaches to that area and it gets infected, so it has to that bundle has to be removed. The infected tissue has to be removed. So here you can see it is removed and then filled with a inert material. This white thing is the inert material which is filled. Similarly here also. So gone are the days when if you have a tooth pain or unbearable tooth pain, you have to extract the teeth. It is no longer like that. You can get an RCT done and have the services of that tooth. So that's about root canal treatments. These are the latest. Many of you would have heard about it. Bridges and implants. Implants are the latest. Bridges were there before also. So a basic difference between a bridge and an implant. So suppose you have one single missing tooth. There are two ways of replacing it. Either we cut some tooth structure of the adjoining teeth so that there is a bridge that can be made and it supports the tooth which is missing. So in this case, you are sacrificing some of the tooth structure, healthy tooth structure of adjoining teeth. But in case of an implant, the adjoining teeth remain as it is. We don't touch them. You just insert, we just insert a titanium medical grade screw. That is an implant. It's a very, very simple procedure. It is because the if we are placing it immediately, the space is also there generally. If the tooth has been lost quite a while back, in that case bone would have formed, then we can drill into the bone. But it is a very, very simple procedure. Hardly takes around 15 minutes. So on top of that titanium medical grade screw, we place a crown. And that is how we restore. So this is the closest to a natural tooth. As you can see, the teeth which are adjacent to this implant are also natural. So here we have this yellowish thing, which is the root of the tooth. It is inside the bone and covered by gums. So you cannot see it. What is visible in the oral cavity is the white thing, which is the crown. Similarly, here also the root, the implant becomes the root, and crown we place on top of the root. So this is the closest which is possible to a natural tooth, an implant which is rehabilitated by a crown. That is the closest to a natural tooth. All the phenomena, this gets fused over a period of time. The screw which acts as the root, the titanium screw, gets fused with the bone, and it acts as a natural tooth, just like a natural tooth. You do not have to sacrifice healthy tooth structure like in a bridge. Anyone has got an implant procedure done?
I have got it. Yeah, I have got it done.
You have got it done, sir. If you can just share your experience and if you're using it, what?
Sir,
Yeah, go ahead, sir. Go ahead.
if we are diabetic, can we go for implant?
Yes. So the thing is that so for diabetic, there is something known as a glycemic index. So HbA1c, if that is less than 8, for a diabetic also, a controlled. So our basic idea is the diabetes is fine, but it should be under control. It should be controlled diabetes. So if the HbA1c is less than 8, implant can be done because it is even less invasive than extracting a tooth.
Okay. Uh-huh.
So it can be done, but yes, we have to see what is the HbA1c.
Okay. Thank you.
Because diabetes basically hampers the healing of the wound. Whatever during a surgery also there is a small wound which is created, so that healing of that is delayed. So in this case also implant healing will be delayed. So that is why it is vital for us to see what is the HbA1c. If it is in within the medical limits, even if it is on a higher side, we can do a implant. There's no problem in that.
My
Okay.
experience
Thank you.
with the implant is, yes, implants are very useful. It's very easy.
Right.
It's very easy to put. Only thing is, I think there are several grades of implants. Several grades, I mean, several methods, I mean, several types of implants. And the
Okay.
prices vary vastly. And it, I mean, maybe it starts around the 20, 25, 20,000 to say it goes up to 30, 35,000 rupees.
Yes, yes, exactly, sir. That is because this is going inside the bone.
Yes.
So that is why it is made of titanium also, because titanium is a biocompatible alloy. Because otherwise, if we place something else inside the bone, it will be rejected immediately. So that is why the cost is slightly on the higher side. But then, as I already mentioned, it is an exact replacement of a natural tooth.
Yes. But it takes some time. So it's not, although the procedure is a very easy procedure.
Yeah, yeah, it takes, because the healing time will be there.
Yeah.
It has to get fused to the bone.
Yes. We can talk something about gum replacement, gum reconstruction. See, most of us face this gum problem, especially in the
Yes,
senior citizens because of our age. There is a receding of gums. So,
yes, yes.
is there any latest technology available for improving the gums health?
Yes, sir, that is also there. I'll discuss that also.
Yeah, yeah. If you
Uh,
like,
so yeah. So I'll discuss the point which sir put forward. First, I'll discuss that only then. So as rightly brought out that yes, with age the gums start receding. So unfortunately, receding gums are irreversible. We cannot get it back, but we can stop it at whatever stage it is at. So suppose there is a loss of around 2 to 3 millimeter of gums or 4 millimeter of gums, we can arrest it at that stage by proper thorough laser cleansing, laser curettage. It is, the procedure is known as curettage. So that can be done by hand instruments, the surgical instruments, or nowadays we have got the facility of lasers, which is less painful, the healing is earlier, there is no blood involved. So that is there. So what happens is that the dead tissues in between the gum and the teeth, like between the root and the gums, are removed, and then the new tissues will form. So that is called reattachment. So whatever is lost, it will stay till that stage only. It will not get further down. For the lost part of the gum, there is some reconstruction surgeries also which we can do. That is again from the nearby area. We take a part of the gum and place it over, because the blood supply has to be there continuous. So those things are also possible. So those procedures are called periodontal flap surgeries. So basically, you are just moving the flap to the place where the gums were earlier, and then stitching it off there. Slowly, that will form there. So there are two types. So that's the basic. So basically, one is arresting at that stage. Otherwise, it will keep migrating down, 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 and finally, the whole root will be visible. So in some people, you might have seen, I don't know, that almost the complete root is visible, most portion of it. So that will not happen. So one is arresting at that stage, and the second one is yes, also regaining the lost attachment and covering that area which is already lost. So these are two different scenarios. In one, there is a minor surgery involved. In the other one, we can do it without a surgery. It is just with laser we can do it.
how cost effective it is done.
It is very effective, sir, because what happens is regeneration. So the gums which are surrounding our teeth are one of the most um, regenerative tissues in the body. So, but the thing is, the dead tissues has to be removed. Otherwise, they act as a barrier to regeneration. Once those dead tissues are removed, there is regeneration, which is a natural process that occurs, and reattachment takes place. So, it is effective. If it is done well, it is definitely very much effective.
Any idea about the cost? Sir? Any rough idea about the cost?
Cost wise, so what happens is, because individually between the teeth it has to be done, generally the costs are determined by how many teeth are involved. If there is 2 to 4 teeth, then it is somewhere around 4 to 6 thousand. If it is more than that, then the cost increases like that. So with, if it is full mouth, in that case it falls somewhere between 18 to 22,000. If it is all the teeth are required to be done,
Once you do it, how long it remains? Sir?
it will remain, because so the thing is, yes, but the maintenance has to be there, like brushing twice daily, and periodic checkups with the dentist. All those things, if those are followed, it will be there. It is a permanent thing only, because it is happening naturally. So for it to again go back to previous stage or worse than that, then something like if the oral health is not maintained properly at all, then it can happen. Otherwise, it is a natural phenomenon, because the reattachment is happening naturally. There is nothing artificial in that. Only thing is, we are inducing it by removing the dead tissues around. So it stays. If oral hygiene is maintained properly, you are getting your follow-ups done regularly, periodically, it stays.
Thank you, Doctor. Yeah, it helps.
So that was about gum treatment. Then braces and aligners, these are more, I think, maybe for children or grandchildren, or some people of that age in this forum. So basically, what happens is, your teeth are supposed to be in a certain alignment, both the upper and lower. But with evolution, what has happened, and with refined food eating of habits of humans, the jaws have shrunk in size. Okay, so the jaws have shrunk, but the teeth have remained the same size. So now what is there? It is like a typical scenario of any urban city, wherein the people are more, space is less. So it will be crowded. So similarly with our oral cavity also, it happens that the teeth occupy more space, but enough space is not there within inside the oral cavity. So that is why some teeth are front, some teeth are back, some have not erupted at all, like wisdom teeth nowadays. Most of the people, the wisdom teeth is struck, because it has become vestigial. It is no longer in that much use. Then they give trouble at a later stage, so it has to be removed. So at a young age, if proper alignment of the teeth can be done, then these problems won't be there later on. So for alignment, there are two kind of procedure. Braces were always there. These are some brackets which are fixed to your teeth, and some wires. So with the help force of these wires, the alignment is brought in a space. Now you'll ask how the space is created. So what we do, there is something known as small interproximal reduction. So we reduce a little bit of teeth structure from the from between teeth, and that is how the space is created. In some people, the space needed is much more. So in that case, we generally sacrifice a premolar, which is a tooth which is not that much utilized in chewing, so that that space can be utilized to free up the other teeth. And it is a so these typically these treatment take around 1 year to 2 years, or 2.5 in some cases. So that is the, so braces are one such procedure, and the second one nowadays are aligners. So in this you need not, so braces can be fixed by a dentist only, removed also by a dentist. There are a lot of dietary restrictions, because as you can see, there are brackets and wires, food will get stuck. So a lot of dietary restrictions are there. This, you can't eat burger, you can't eat pizza, and things like that. But with aligners, These are basically medical grade plastic trays which have to be just put on the teeth, and they will do the job over a period of time. So basically what both these systems do is they move the teeth to a certain position which is correct for the overall alignment of the. So like that, we have braces and we have aligners. In aligners also we have different varieties. These are some cases. This is one individual who had, generally the front upper teeth are in front and the lower teeth have to be painted. But in his scenario, it was the other way around. So this was corrected after treatment. It was like this. You can see this was before treatment and this was after treatment. Okay, smile design. No, this is a new thing and this is something which will be of interest as well. Uh, so basically, as we said that yes, gums also recede with advancing age and the teeth also get worn out because of continuous chewing and food habits. They get worn out. As you can see in this first picture, the teeth are worn out. They are less than the height they should be of, right? So what we do is in smile designing, we again regain the lost tooth structure by placing crowns over.
Mole avuduna.
Yeah. Anything? Anyone wanted to ask something regarding any doubt? Okay. So so basically, this is how we design smile again, redesigning of smile. This is basically. So as you can see, this was a picture before, and after that, you can see there's a lot of difference in the profile, in the smile. Again, full mouth rehabilitation. This is also a kind of smile designing. You can see the complete arch is changed. Here, as you can see, the gums had started receding quite a bit. So on that, we did some gum treatment and then placed crowns over that after doing root canal treatment. So you can see the difference. This is called full mouth rehabilitation. It completely changes the appearance and the personality of the individual. There are some latest advances, like I said, lasers, and I was mentioning about lasers. They are totally, their pain is less, post-operative pain. It is bloodless. It is very minimally invasive, and the healing is faster. Then we have got some 3D intraoral scanners, wherein we can nowadays we instead of taking pictures, we do have those intraoral cameras also, but instead of taking pictures, take 3D image of the teeth and the surrounding structures, which help us in various treatment modalities. It is fast, it just takes around 10 minutes, and the best thing is it can be done at home also, the 3D scanning. And then you need not travel to any other place. That 3D scan will be used for either products making a crown or giving some orthodontic treatment or any other kind of treatment where a lab support is required. There is one more. I'll stop sharing this PPT again. So, why should we replace missing teeth? That is also something which we must uh, see.
Sir, we are unable to hear you.
Just a second. I've not yet
Okay.
stopped the share. Can you see it now? The video?
Yes.
Is the video visible?
Yes, it is.
Yes, sir.
Ah. So this is what, okay, I'll play it from the beginning again. If you missed out something. So when you lose a tooth, what happens after that? This video is just showing that. So here you have unfortunately lost a single tooth only one tooth. So food items get stuck in that area. There will be pain. Later on, after some time, you see the teeth are migrating in that space. All the teeth try to come in that space. Gaps are created. Now food is getting stuck in those areas. Now cavities are forming in the other teeth. There is more deposits. Gums start receding. So this does not happen overnight, but slowly, over a period of time, if you do not replace that one single missing tooth. Now that upper tooth is also become mobile. Yeah. So as we can see, so we saw that even a single missing tooth, that also led to so many different problems, which we would have never realized also. So even a single missing tooth, replacing that is also very important. Okay, if we talk a little bit about our organization, Clove Dental, we started in 2011, and now we are celebrating our 14th anniversary this year, this month only. In fact, this is our anniversary month, and we are across 12 states in 23 cities. 600 clinic has opened pan India now recently this month, and in Bangalore alone there are around 116 clinics. So I will urge all of you to take out time and just visit one of our clinics, if not for anything, just to have a general checkup only done, and just avail our facilities. We would be honored to serve you all. We keep having scientific sessions because a doctor's life is, so that's what our endeavor is at Globe. We keep having scientific sessions, introducing new technologies, teaching it to our doctors. We have got a lot of corporate outreach programs also like this one. So go to places and try to spread awareness, oral awareness, dental awareness. With that, I come to the end of the webinar. Thank you so much for providing me with this opportunity. I hope good health for everyone in this forum. Please keep smiling.
Thank you all for your time and active participation in today's webinar on oral hygiene and general problems. It has been a pleasure discussing the importance of oral health and how it impacts overall well-being. A special thanks to Dr. Sandipan Bhattacharyya for sharing his expertise and valuable insights with us. Your guidance has surely helped us understand the significance of good oral hygiene and how to address common dental concerns effectively. We hope you found this webinar useful and encourage you to implement these oral care tips in your daily routine. If you have any further questions, do not hesitate to reach out to us on 95133000821. I repeat the number again, it's 95133000821, or write us at contact us at via-org. Thank you all. Have a wonderful evening.